Good afternoon and welcome to everyone. Thank you for joining us today for part 2 of our 2-part webinar series for HIV/AIDS awareness. We do have 4:31, so we're going to go ahead and get started to make best use of our time today. My name is Tamara Morris. My pronouns are she and her, and I'll be your moderator for today's session. I'm the Public Health Educator Supervisor in our Health Education Division at the Cumberland County Health Department. This series is being brought to you by the Cumberland County Department of Public Health, the Cumberland County HIV Task Force, the Community Health Intervention Specialty Clinic, the Fayetteville Alumni Chapter of Delta Sigma Theta Sorority Incorporated, the Fayetteville Alumni Chapter of Delta Sigma Theta Sorority Incorporated, Teen Connections, the Fort Bragg Area Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and Teens Do Care Incorporated. Special thanks to the representatives from these agencies for contributing to the planning and the success of today's event. So about National Women and Girls HIV/AIDS Awareness Day, this is sponsored by the U.S. Department of Health and Human Services in the Office on Women's Health, and it's observed annually on March 10th. National Women and Girls HIV/AIDS Awareness Day is a day that we use to increase awareness, to spark conversations and highlight the work that's being done in reducing HIV among women and girls in the United States, and also showing support to those who are living with HIV. This includes advancing PrEP work as well, so a preventative initiative for those who are involved with persons who may be living with HIV. Only a small percentage of people in the US who would benefit from PrEP are being prescribed it, and most are men, and PrEP is effective for women as well. A few housekeeping rules as we get started. If you have not already done so, please put your name and organization in the chat. We'd love to see who is here with us today. We'll be pinning our speakers throughout the presentation so you can see them best by visually putting your view in side-by-side speaker view. As a reminder, this webinar is being recorded and will be posted publicly following the live stream. All participants have been muted and presenters will unmute during designated segments. And please utilize the chat box for any questions. We will do our best to acknowledge as many as we can in our allotted time. And we encourage you to turn on your cameras and engage with us today. But this is safe space, so we understand that if you should need to remain off camera, that's okay as well. There will be an evaluation link provided at the end of the webinar. So please share your thoughts on this series with us. This event is sponsored in part by funding from the Cornelia Neal Bullock Wilkins Charitable Endowment Fund for Health of the Cumberland County Community Foundation Incorporated. We hope that you enjoy this insightful educational event. Please engage with us in the chat. You can post on our social media events page as well. Please keep in mind that all of the views that are shared today, any expressions may not be that of the local health department or partnering agencies, but the findings and conclusions are that of the authors and are intended to empower progress as we continue to make visible the resilience within communities. So let's get started. We learned a lot from part 1 of this series. It was very exciting. We had a large group of folks come in and participate and engage with us. So we got an update on HIV as it is affecting Black people in our communities. We got information on PrEP as a prevention measure, and we had a panel of experts discuss how to push empowerment forward. We've got a lot more great information for you today, and we're going to start that off with a keynote that's going to discuss advocacy and prevention and also some work in faith-based communities. So here to lead us in that is Dr. Linda Battle. Dr. Linda Battle received a bachelor's degree in biology and chemistry from Francis Marion University in Florence, South Carolina. She then went on to serve almost 10 years in the U.S. Army, where she served as the casualty officer for the 18th Airborne Corps during Operation Desert Storm. For her service during the Gulf War, she was awarded the Bronze Star Medal of Valor in addition to other recognitions. After getting out of the Army, she went to nursing school at Columbus State University in Columbus, Georgia. She went on to receive her master's degree in nursing with a specialization in public health nursing from East Carolina University in Greenville, North Carolina. In 2009, she completed her Doctor of Nursing Practice, or DNP, from Regis College in Massachusetts, where her dissertation was titled Barriers to Faith-Based Primary Prevention of HIV/AIDS, specifically in communities of color. As a staff nurse, she worked primarily in women and children's health. She worked her way up to becoming the director of perinatal services at 2 separate hospital organizations. She has had several adjunct and full-time academic appointments since 2001. And she's also a board certified by the American Nursing Credentialing Center as a public health clinical nursing specialist. Dr. Battle's originally from Boston, Massachusetts, but lived in Texas for over 12 years. She recently relocated to North Carolina, where she currently lives with her 26-year-old son and 3 little fur babies. In her spare time, she finds it rewarding to use her nursing knowledge to nurse sick little dogs back to health and find him or her a forever home. Currently, Dr. Battle teaches public health nursing at Grand Canyon University in Phoenix, Arizona. She is also the lead faculty for population and global health nursing in the BSN program at Walden University. Dr. Battle has been a member of Delta Sigma Theta Sorority Incorporated since 1986. She's currently affiliated with the Fort Bragg Area Alumni Chapter. So without further ado, we're going to welcome Dr. Linda Battle, and she'll be able to share her screen.
All righty. I've had a little technical. Is my screen shared? I don't know. I better.
Not currently.
Okay, hold on a minute. You know, whenever you have anything to do, that's when you have all these technical difficulties. My camera went down, so I'm also on video on my phone. So, all right, let me see if we can get this done correctly.
All right. Seeing your screen. Thank you.
All right. Thank you. I just want to thank Tamara for reaching out to me and asking me to do this. This is one of my passions, actually, working in public health and specifically working with communities of color and addressing health disparities. It's really interesting that today we have is National Women and Girls HIV Awareness Day. Has anyone seen anything about this on TV, in the newspaper, or anything like that? I think that's kind of interesting because this is something that has been on the calendar since 2005, but it's almost like we're not doing any more discussion specifically about HIV. See if I can get these slides to. All right. So one thing I wanted, when I was asked to speak, I didn't know what angle that I wanted to take. One thing I wanted to say is specifically changing the narrative. Initially, years ago, when we first started really talking about HIV, and you know, initially HIV was more associated with homosexual men, promiscuity, and IV drug use. But those that work in the field, we know that this is no longer the case. I'm trying to make sure I get these slides to go. All right, so looking at that, in 2018, there were 37,968 new HIV diagnoses in the US. Now, to some, you might say that's not a large number, but if it is your sister or your mother, your cousin, or your best friend, it is very significant. Of that large number, about 19% were among women. And when we're looking at that, that's about 1 in 5. I just want to show a little short video here. Hopefully it's going to.
Can't hear any
And Dr.
sound.
Battle, I'm not sure if the sound's enabled. I can't hear.
You guys can't hear the sound on it?
No, ma'am.
Ooh, I don't know.
If you'll click back on your screen share button and if you enable sound for your slides, it should work.
Okay, that's, where is that? Okay, click on the share. I got it. All right, let's see. It's those gremlins, but we're gonna go again.
Are more likely to become infected with HIV.
All right, let me see if I can, I'm not sure if I
Because
can get
there's
this
more
to roll
HIV
back.
in the communities in which they're having sex. Nobody wants to be a statistic, right? You want to be a person. If you're in a community where there's a lot of HIV and you don't know it, the chances of you getting it are higher. If we keep thinking of HIV as something that only happens in those communities, then we won't get tested because you'll say, oh, that's not me. I don't fit that bill. I'm not that person, so I don't need to get tested. Not because you didn't make all the right choices, but because you allowed the story to stop you from getting tested.
So how does that affect me? When we're looking at new HIV diagnoses among women by race and ethnicity in the US and dependent areas, if you look at that, look at Black and African American women, 57%. Now, how is that significant? Depending on what study you read or you research, the African American population here in the US is between 12 and 13%. But yet, out of the diagnoses for Black and African American for HIV, we're 50%. So that's one of the obvious disparities. So looking at HIV diagnoses among women and girls by age and transmission category, as I started off in the beginning, we need to change the narrative. So if you look at the ages there, 14% between ages of 13 and 24, 27% between the ages of 25 and 34, 24% between the ages of 35 and 44, 20% between the ages of 45 and 54, and 16% of the women with HIV are older than 55. And if you look at how it was transmitted, 85% of those were through heterosexual contact. So putting that into context, I'm someone that looks at visuals. So 14% of the women and girls diagnosed between the ages of 13 and 24. You see, that's the young girl that plays the youngest daughter on Blackish, and that age group. And we think about it, we don't like to think about our young women are actually having relations. But in the past, I was a labor, exactly, Virginia, my goodness. In the past, I was a labor and delivery nurse. And I can't tell you the number of 7-pound kidney stones that I delivered in 11, 12, and 13-year-old patients or clients of mine. So then looking at 27% of women are diagnosed between the ages of 25 to 34. And we know Simone Biles, she represents that group. And I'm just using these pictures to give you something to connect with as you're thinking about this. And then we know this is, her name just slipped my mind. Yeah, I always call them my kidney stones. And we know her, well-known actress. 20% of the women diagnosed are between the ages of 35 and 44. And then going on, just want to make everybody smile as we're talking about such a serious conversation. 16% of women who are diagnosed with HIV are actually over the age of 55. So when we're looking at it, I I came from Texas. I was originally in Massachusetts when I first started doing this work. If you look at it here in North Carolina, y'all, we made the top list. Okay, North Carolina is actually number 9 when we rank states for the numbers of women and girls to be living with an HIV diagnosis. And when we're looking at the United States with the highest HIV diagnoses, once again, we have made that list. We're actually number 10. And a lot of people don't think, when they're talking about HIV, a lot of times they'll think California, Massachusetts. You can see California, they've done a good job. They're not even on the list of the top 10 states affected by HIV and AIDS. So this is something, and I want you to take your time when you're looking at that, looking at the age distribution of people diagnosed and living with HIV. The blue is the males, and then that dark purple color, that is the females. So you can see it's affecting a lot of the ages, 35 through 39, 40 to 40. You can see, and we don't think about it, what is really interesting, look at that age 65 and older. Quite significant for women. And one of the things we talked about, originally my outreach, one of the things, my dissertation was actually barriers to faith-based primary prevention of HIV/AIDS, specifically in communities of color. Now that's a long sentence to say that I wanted to know how I could work with the churches in the communities of color. And this comes from a historical standpoint of the work I had done in the past. When I was contacting churches, I would call them, identify myself, and I would say, oh, I want to come down and do some blood pressure screenings. Come on, I want to do diabetes screenings. Come on, I want to talk to your congregation about HIV. Either I'd say I'll get back with you, or if I left a message, they wouldn't call me back. And I want to say, well, how come? Why can't we talk about this within the church? And especially when we're talking about women. Years ago, it used to be go to church to find a good man. Well, that hasn't been my experience, because when I go to church, it's usually about 80% of the population, 80% of the congregation is actually women. So being realistic, that's like a captive audience right there. Thank goodness through my work, I ended up working with a bishop. And once I was able to talk to him, and he's like, really? Because he just wasn't aware of the numbers. He wasn't aware how HIV was disproportionately affecting the communities of color. So one thing that he did, and I was very happy, he ended up bringing in all of his faith leaders. He was over probably about 20 churches. And of course, if the bishop says you'll do this, they'll come. And so all the leaders were in there, and we did education related to not only HIV, but all of the health issues. And so one thing that he did annually is called Unity in the Community, and where he would do all kind of stuff. It was right in the summer before school started, and just have a nice little block party, which he was able to have the whole block that the church was on. And he asked me to have outreach, all types of testings and things like this. And I'll make a long story kind of short. One of the ladies that came up to our tent, and she really came up dragging her granddaughter. And she was one of the older ladies from the church. And she was telling Grandma, I'm just going to set the example. She grabbed her granddaughter's arm, and the granddaughter was kind of embarrassed, like, Grandma. Well, in the process, she was like filling out her little consent. And one thing that really stood out, she's like, I haven't done anything for years, but I'm going to go ahead and set the example for my granddaughter. And I was like, well, it's more information I need to have, but come on in here, let's get this test. And so she was tested, her granddaughter was tested, and a whole bunch of other people were tested. This was on a Saturday. On Monday, I was in my office and I got a call. Well, guess what? The grandmother was the one that was positive. Someone, if I had to pick people out walking down the street, I would have never. And remember, one of the things that she said, which really stood out to me, she said, I haven't done anything for years. So that tells me that she has been positive for years. So that was something that was really kind of interesting. Had we not done that outreach in the community, and I'm just going to make up a name, Sister Jenkins would have been laying up in the hospital. We're trying to figure out what's going on with her. But what happened is she would have had one of those opportunistic infections. One thing, and we'll talk a little bit about testing, and I know we have some resources coming at the end of the program. One thing about testings, people of color are normally considered what we call late testers. A late tester means someone that has tested from the time that they have tested positive to when they get one of those opportunistic infections, whether it's Kaposi sarcoma or some of the pneumonias that we typically associate with HIV, is less than a year. Now, the reality with an HIV infection, when an individual is infected, they may or may not feel somewhat slight flu-like symptoms. Usually those subside for 2 weeks. Then the HIV goes dormant for up to 8 years. So if the individual doesn't know that they're positive, anyone that they are having unprotected encounter with, I'm trying to be politically correct, we're all has a risk of being infected. So we're going to talk a little bit, and I know we have trying to go through my slides, talking about some resources here in Cumberland County for testing. And I'm trying to make sure I get these here without clicking off of them. So as a public health person, one of the documents that we use to guide our practice is Healthy People 2030. And one of their objectives is to reduce the number of HIV infections. Okay, so we've talked about that. And I have on there, especially because we're dealing with dealing with women. We talk about consensual sex. A lot of times when we think of consent for sex, we simply is it forced sex or something like that? They're not willing, but we want to say consensual sex with a condom. We've all heard it. People have said condoms are uncomfortable. Any woman who's in this has probably heard it. Condoms are uncomfortable. I don't like using condoms for whatever reason, but we want to make sure as women we are protecting ourselves. And one thing I always say is I love myself more than I like you. So another objective under Healthy People 2030 is increase the knowledge of their status. As we talked about in the beginning, only about 85% of those that are positive actually know their status. One phrase that I tend to use all the time when I'm talking, even when I'm talking with clients, are you positive that you're negative? How do you know that you're negative? Everybody walks around, we want to make the assumption that we're negative, but if you have not had a test, you will not know that you are positive. So when we're talking about women, we're talking about how do we start the conversation? That's kind of, because if I bring that up, is that person going to say, look at me like in a different manner because I asked them, having that conversation. I know my status. Do you know your status? So we have to be able to, especially when we're talking about women and our younger women, we have to find a method for them to be able to be comfortable and for them to advocate for themselves and have those conversations, which for many can be very difficult. So here's just another little video. Hopefully my sound will go.
My name is Helen Turner Goldenberg, and I am living my 70th year, and I was diagnosed with AIDS March 13, 1984. When I was diagnosed, I thought I did not fit my then stereotypical profile for being infected with HIV. In fact, I thought the doctor did not know what he was talking about. I wasn't buying it. I was an assistant vice president at Bank of America, and I chose to go back to work and not pay attention to that diagnosis, not getting care. And that's something that happens quite frequently with people who look like me, because blacks are sometimes frequently actually diagnosed late, and their diagnosis tends to go into AIDS much quicker than others. And I used to say that is just like me with my cultural black background. If I died today, I'm thankful that I have lived 34 years with AIDS. They used to call full-blown, of course there's no such word as full-blown anymore. AIDS is AIDS. So I'm thankful. So every day I wake up, I purpose each day to go out and do something to help somebody else. And that gives me my happiness. Of course, I still do this at night when I go to bed, because I'm still asking God to send me a stable relationship that ultimately leads to marriage. I've done that twice, that marriage thing, and I like it. So it's coming my way again, if that's God's will. And if not, I just keep doing what I'm called to do, and I'm happy doing that. My name is...
Okay, as we said, this looking at what the face of HIV AIDS is, it's no longer what we initially thought it was. And like I said, that's the story of a woman who is in her 70s who has been positive for well over 30 years. This next individual, Michelle Lopez, she's actually a personal friend of mine, and I've been doing work. She's actually in New York. I've been doing work with her for years. And when you look at her, that's one thing, even I, as a person who has been working in HIV, I had my own biases on what HIV looks like. And even when I first met her, I was like, she is so beautiful. She is so vibrant. So I just want you to hear a little bit of her story.
I wrapped my daughter in a blanket. She was 9 months old at that time. And I left the household that I was living in, severely beaten. And I just started riding the trains. I live in New York, Brooklyn, New York. And I started riding the trains, just asking God to send me help. And on that train, I saw an ad. And that ad actually spoke to me, and it said, if you're a woman who is having to live with domestic violence situations, drug use, or you just need help, you can call this number. And I agreed to take an HIV test. But I was not just tested myself. My newborn baby, she's 22 today, she was tested also. And we both, within a 2-week period, had the results confirmed that we were both HIV positive. Do not segregate yourself. There is over 1 million of us living today with HIV. There is help out there today. Seek out the help. Talk to someone. Talk to someone about how it's making you feel. A lot of times we internalize what we're feeling, and that's where we start breaking down. You're not alone. You're not alone being diagnosed with HIV. Don't hold it inside, because it is a lot to hold inside, and your life is not at an end. Don't look at it as a death sentence, because it's not a death sentence anymore, and you can still be who you want to be in life. HIV affected my life in many ways. I've been stigmatized, I've been called names, but that still haven't stopped me from who I want to be and sending a message out to the youth. And I'm not going to stop doing what I have to do until there's a cure As a positive person, I see it as my responsibility to help educate society, to give back to my community, to stop the spread of HIV.
Let's stop HIV together. Get the facts, get tested, get involved.
I wrapped my daughter in.
And one thing about Michelle, I've known her for years. When I first met her, her daughter was 5 or 6 going into first grade. Her little daughter has been an advocate before she even knew what advocacy was. I remember when Michelle telling me a story about when she took her daughter to her first day of kindergarten. It was either kindergarten or first grade. And the teacher was like really standoffish and things, and said something in front of Michelle and her daughter. And this time, the first time Michelle actually heard her daughter speak up and advocate for herself. And she said, you know how we little girls do. I don't know why you're afraid of me. I should be more afraid of you because I'm the one that's immunocompromised. And she walked on into the classroom, and she's been an advocate in this fight forever. Somebody asked the question, does regular STD test include HIV testing? In most cases, it does not. So I know when I was in practice and someone would come in, they'd have an exposure. I always made sure that I asked them, do you want an HIV test too? Even in the same way, if someone came in, they found out they were pregnant, they didn't, they tell us all the stories, they didn't really want to be pregnant. Well, congratulations, you're pregnant, but can we also do the HIV test? Because we know the same way you got pregnant is the same way you can get HIV. So here's one last story. When we're talking about living with HIV, it's not a death sentence like it used to be. I know several people who have been living with HIV for well over 30 years. So.
HIV, he may be living inside me for the rest of my life, but I'm in control of my life. I got on HIV treatment as soon as I found out my genotype, so maybe like 8 weeks after I found out. And I learned that with the medication, you're less likely to infect anyone else. So I decided to not only keep myself healthy, but protect others as well. My labs have been perfect since I started taking medication. When I say that my labs are perfect, I mean like my CD4 count is normal. I'm undetectable, and it's important to be undetectable, simple fact that when someone is undetectable, they're less likely to infect other people, they're living a healthy life, and they can still have children. In the beginning, it wasn't easy because a lot of people are uneducated about HIV, so they tend to break away or keep their distance because they don't know what's going on and they don't understand. But the key is educating them, because I educate my family now, and they're not afraid. They're not afraid of me dying no more. They know I'm okay. I still play with my son. I still do everything normal. And I think the only thing that changed about me having this virus is making me realize I'm a lot stronger than I thought. So why should I say someone should be ashamed that I have HIV if it doesn't change who I am? HIV treatment works. Get in care, stay in care, live well.
And so one thing that you would stress getting tested, you cannot get in care if you don't know your status. And so as I started, we're going to close up now. As I began the presentation, I called it Changing the Narrative. If some of you guys could just participate in the chat or even come on live and say, what would you do knowing this information to change the narrative or to help change the narrative?
I'll volunteer as tribute, Dr. Battle. I think that for us in our health education division, we just continue our efforts at outreach and education, especially in populations of young people with impressionable minds and potentially risky sexual behaviors. We support the schools and their implementation of the Healthy Youth Act and the information that they provide to young people on anatomy and sexual risk reduction and unplanned pregnancy prevention. And that includes HIV prevention as well. So just continuing our efforts of education and making sure that they are aware that they have options to protect themselves and be their best well selves.
Good. And Heather said that she would have conversations early and often with those they care about. I would expand on that. Those that I care about, those that I don't care about, I don't have to know the person to have these conversations, but we really need to change the narrative. And one thing that I always say, it starts with me. What is the face of HIV? And I have our Denton County, I don't know if you can see this, the way has these little mirrors. And it came to myself that looking in the mirror, I'm going to start with me. This is an objective and a goal and a task that I have. And I would challenge everyone as you go on after this day, start with yourself. I would challenge everybody to have, in the next week or so, have a conversation with at least one person. Yeah, college age, we're in the dorms as it is allowed by the university. You would be surprised how open and receptive. I know I've been doing this work for a while, and my son used to always go to my presentations, and he was maybe 10, 11, 12, and I never knew he was really paying attention. He'd be in the back of the room playing his video games. But one thing that I found once he started high school and was playing football, he was going into my stash for teaching and handing out condoms to his football team. How did I feel about that? I was like, go Alex, go Alex. I was happy about him doing that. I didn't have any problem with it. And even now he's in his 20s. He is always the one that has those conversations. So, and I think that is the end of my part.
Thank you so much for all of that insightful information and giving us things to think about and how we can press forward with empowering women and girls to get tested, to know their status, to share information with others. We've got a couple minutes that we can take a few more questions for Dr. Battle if anyone has any. I know we had a few more comments talking about it more in strong educational teachings, how that could improve processes over time. And some thanks for your great presentation, Dr. Battle. But does anyone have a question that they'd like to come off mute or drop in the chat?
See, we just mentioned having these conversations. So somebody.
I actually have a question. I'm Denai. I'm with the health department. Why do you think that with STD testing, HIV is not mandatory? Like it's not an automatic test?
Well, it has changed quite a bit. Years ago, it used to be you had a whole separate consent that they had to sign for the test. And then whoever witnessed the consent had to be the one to give the results. Now, that was one of the laws. Massachusetts was one of the last states that actually changed that law. I got to work on a lot of lobbying with that. I know in my own clinic that I was the manager of, we had someone who did the test and she had issues with attendance. So they do the test, sign the consent, the person would come back. She wasn't at work. The person would come back again, and then the people would stop coming back. I'm not sure why it's not part of the normal panel. I mean, diabetes is part of your normal panel when you go in, but this is something you have to specifically ask for. And I found out as a clinician, they're not comfortable saying, that they're more afraid of offending a patient. Can I do an HIV test? Doesn't mean I'm saying you assuming anything. You're in that age category. You're a woman or a man. But we need to, people, I think it's just having more dialogue where people aren't afraid to say, add that to my panel. One thing that I want to know, and especially dealing with women, clinicians are not doing what they're, I hate to say it because I am one, are not doing what they're supposed to be doing. They say, the American Cancer Society says every time a woman goes to a physician's office, they need to have a clinical breast exam. How many, and I mean, that means going to the doctor's office for, you're supposed to have a clinical breast exam. I remember when I was in Arizona and I had my normal yearly visit physical, he wanted to send me to another provider to have all my well women stuff. I'm like, I'm not paying another copay. I'm here, do everything that you need to do. But he wasn't comfortable with that part. So to me, that's not a competent physician. And if I go to a physician and they're not comfortable, then that's probably not the provider that I need to go to. We need to be our own advocates for ourselves and our health.
I agree wholeheartedly. Thank you so much, Dr. Battle, for that information. I do see a few more things coming up in the chat. So if you can try to answer things that are directed to you. And we're going to move on to our next.
Melissa, oh, hold on. I have some people all over the country on this. Melissa, what'd you have? I see her saying she has a comment.
Are you unmuted, Melissa?
Yes, I was. Can you hear me now?
Yes.
Okay. I just wanted to add that I am an advocate of, it's really important to me, vulnerable populations. And for those, I see we're talking about, you know, communicating with people that we're in contact with all the time. But for those people that will not ever come to church, or those people that we won't pass in the store, those people that we don't work with, and I'm referring to people in the community. And when I think of vulnerable populations, I think of like homeless people. Like we need to be communicating with all these type of populations, you know, educating them, because education is going to be the most beneficial. It's going to be the thing that really reaches people, because I mean, we perish for the lack of knowledge. And so if people don't know, then they're not going to act accordingly. So for those people that we see in church, you know, anybody can reach them, but we need people that's going to actually go out and talk to the homeless people. You know, you can get them to sit down and listen if you just buy them a meal. You know, I'm going to buy you this meal and I want you to sit down and listen to me, educate you about HIV, because they need to know too. And it's the same with, you know, adolescents. I know that we say we're going to the schools, but sometimes we just need to get with them, you know, in a setting that they're comfortable in, maybe with other peers outside of the school where there's no teachers or there are no adults, so they can ask the questions that they want to ask without feeling pressure and wondering who's watching them and if they're going to get in trouble for, you know what I mean? So I just think it's important for us to consider the vulnerable populations and keep them included in educating them as well.
Yeah, I agree. That's a great addition. We can talk more if you'd like to reach out. I'll put my name and email in the chat as well to talk about some of the efforts that we have and connect you to some of the collaborating agencies if you have other ideas you'd like to share. But that's really good. Thank you. Ms. Jackson, you had a question?
Yes, we're doing, you know, the kids' age, and tell me if I'm wrong, 12 or 13, they can go in there and ask the doctors for pregnancy tests and things of that nature without letting their parents know. Are they able to ask for HIV testing as well?
They are. So they have confidential services available to them in teen-friendly clinical services. Specific to the health department, we have a teen wellness clinic, and they have comprehensive sexual health and wellness services there that minors' rights cover them. So they are legally not required to get caregiver permission to receive those services. But we do encourage them to have open communication with their caregivers, guardians.
Okay, thank you.
You're welcome. Thank you guys so much. And as I said, please continue to ask questions in the chat if things come up. Dr. Battle, myself, and other people who are here from agencies who serve young people, women and girls will try to answer those to the best of our ability. But we're going to go ahead and get started with our next segment, which is our Girls Guide to HIV prevention. And so we have here with us today, Heather Williams, pronouns are she and they. And she is a community health educator with Teen Connections of Planned Parenthood South Atlantic. She's been a community health advocate and organizer and educator for over a decade. She currently coordinates the LGBTQ plus focused health education program Include, and this is for youth and families across North Carolina, South Carolina, Virginia, and West Virginia. So welcome to Heather, and I'm going to stop sharing so that she can share.
So much, Tamara. So it is such a pleasure to be here today and be chatting with you all. And hey, Dee, that's my colleague, Dee, there. And so I've had the pleasure to work in Cumberland County for a really long time, along with Tamara and Dee and everybody. And one of the things that I really want to focus on here is the way that we engage young women and young girls, because we understand that it's something that it's a lifelong process. You know, Dr. Battle mentioned that she had a client, a patient who came in who was a grandmother and had lived with it for likely for many, many years. And we understand that HIV, these are conversations that would need to be held early and often, to where young women need to know how to advocate for themselves. And so really quickly, I'm going to show a short video that I like to share with young women and girls when they're in some of our programming and classes, that talks a little bit about, like, it's a little bit educational, informational, but I also want you all to pay attention to a couple things in terms of what you notice and how the information is being presented. All right, so give me a thumbs up or say, yeah, I'm ready to go in the chat, because y'all know I'm an educator. I got to get some feedback from you. All right, awesome, thank you. I see some thumbs up, thank y'all. So I'm going to share my screen really quickly. Give me 1 second. Okay. And let's see.
Every Tuesday is assembly, then Wednesday is Vintage Video Game Club, and Kevin? What are you wearing?
Hey, this is for my own protection. I heard there's a new kid with some kind of UFO virus. I think you might be talking about me. I'm Monroe, and I don't have an alien disease, but I do have HIV. HIV? That sounds even scarier.
It's not scary if you know the facts, Kevin. HIV stands for Human Immunodeficiency Virus. The virus attacks certain white blood cells that fight off infections and illnesses. This can weaken a person's immune system, making it less effective at protecting the body. If it's left untreated, HIV can lead to a more serious condition called AIDS, Acquired Immunodeficiency Syndrome. A person with AIDS is vulnerable to other infections, including tuberculosis, pneumonia, certain types of cancer, and more.
Oh man, I think I need more safety equipment. Don't worry, Kevin. You can't get HIV through casual contact, like touching, kissing, or even sharing a glass of water. HIV can only spread through contact with specific body fluids: blood, semen, vaginal fluids, and breast milk. So it's usually transmitted through sex or sharing needles. Untreated HIV can also pass from mother to child during pregnancy, birth, or breastfeeding. It's less common, but that's how I got it.
To protect yourself and others, either wait to have sex or use condoms every time, and don't inject drugs. It's really important for people who have sex to get tested regularly for HIV and other STDs. You can get tested by your regular healthcare provider or at a family planning clinic. There are even some tests you can take at home.
Is there any way to cure HIV?
Unfortunately, there's no way yet to completely clear HIV from the body. So once you get it, you'll always have it.
But the good news is, there are a lot of safe and effective medications that can help people with HIV to live healthy, long lives and reduce the chances of passing it to others. There's even a drug that can prevent people from getting HIV if they're at high risk. I have to take my medication and be careful, but I'm healthy and I have a great life. That's awesome, Monroe. Sorry I was acting weird earlier. It's okay.
Hey, why don't you join us for Vintage Video Game Club?
Yeah! With only one button, you can really savor every press.
So with that, give me 1 second. I'm dealing with technical issues over here. So with that, I really like to show that video to the young people that I work with, but I want to hear from you all here. Like, you can put it in the chat or you can come off mute. What are some things that you all noticed about the interaction, even though it was an animated interaction between those young folks? Did you notice anything like that stood out to you, or like besides the fact that it was animated, right? Did anybody notice that there was a lot of advocacy going on? Give me a head nod, just blink once if you got me. Okay, thank you. Yeah, so whenever we're talking about HIV prevention, I think it's really important, much like what Dr. Battle was saying, that we recognize the ways that young women and girls can be advocates for change in terms of being, you know, a voice to correct misinformation. So for instance, in that video, one of the conversations that consistently comes up is that, you know, the one young person was like, you know, decked out in this protective bubble and was really stigmatizing and creating an environment of shame to that other student. And the young woman was the one that said, actually, you know, with a little bit of information, in less than 2 minutes, I'm going to correct this misinformation, right? And so I think that for those of us who serve young women and who serve in our community, recognizing, you know, that there's a lot of power for us to allow, like, to empower young people to make like different choices, right? So I see in the chat someone mentioned, you know, initial fear of the unknown. Exactly. And also, yes, I love that, Latasha, like loving that, you know, once you're educated, you can dispel these myths. And so we know that young people, it's kind, you know, humans, we mirror each other, right? You know, and we want this sort of mirroring behavior to come from a positive place. So for young people to have access to medically accurate health information, knowing where they can go to get tested and resources for support, right? You know, like the Cumberland County Teen Clinic does an awesome job of, you know, working with young people, but also letting other young people know, like in the schools or out in community programming, like letting them know, you know, where they can go for healthcare, right? And so also, you know, clarifying, you know, assumptions or stereotypes. And I think specifically too, as we're talking about, you know, HIV prevention and working with women and girls, the recognition too that there's a lot of gender bias that can play into it as well, in terms of the kind of care that a health provider may be able to provide for women, especially talking like Black women, in terms of medical bias in that way. But also the recognition that, you know, wanting to make sure that, you know, young folks have access to the information they need when they need it. And recognizing that, you know, getting tested, knowing status, their status, and making it to where we take a lot of that shame and stigma and that burden away from young people and making it sort of just part of how they take care of their health, right? So thumbs up if you agree that like these conversations should be held early and often with young women, young folks, and that like we should be like standing up and staying clued into that, right? Awesome, excellent. So I think I'm a little bit over time, Tamara. I apologize if I am. I kind of tried to shorten it a little bit. But you know, recognizing too that we know when we're working with young women, and it's only part of the puzzle, and it's really incumbent upon those of us who are in public health to follow up those conversations as well. So yeah, thank y'all so much for your time. Tamara, I'll pass it back over to you.
Yeah, no, I really appreciate that. And animation is a great way to get stuff to young people. We received another comment where someone said, each one teach one. And, you know, that applies so much to our work as educators. So I know you might have had some, you know, true or false or some questions for folks, and you're welcome to hit those real quick if you'd like.
Okay, I will go ahead and do that. So what we're going to do is we're just going to do some basic questions to engage folks. These are usually questions that we pose when we are first teaching some of the youth that we work with around HIV and AIDS. But today I want you all to sort of put on your hats as learners, because we're always learners, right? Like I hope that we can always learn no matter what age we are. And I want you all to answer in the chat. Tell me if some of them are going to be multiple choice, some are going to be true or false. Give us your best answer. All right. Thumbs up if y'all are ready to rock and roll. All right. We're all learners today. All right. Give me 1 second to pull that up. All right. So myth or fact, and I'm going to pull up the chat so I can see everything really quickly. Myth or chat. Actually, let me go back. Using a latex, oh my word, using a latex condom during sex can reduce the chances of getting an STD, including HIV. So is that a myth or fact? The fact, y'all are fast on it. You like, yes, that's a fact. So if someone is allergic to latex condoms, using materials such as polyurethane or polyisoprene can provide HIV protection as well. And it's really important that we're having conversations around how lambskin condoms or natural condoms do not, because they are porous, and how they can still allow the transmission of HIV through those pores. So, y'all, great. All right, myth or fact? A water-based lubricant or lube can help to increase the efficacy of a condom. What do y'all think? Myth or fact? A water-based lubricant can help increase the efficacy of a condom. Fact. Got some facts coming up. Okay, some people say myth. Okay, some people are saying myth. Okay, so I'm glad we've got a few different answers in here. So this actually is a fact. So lube can actually make sex safer by reducing the risk of a condom breaking due to friction. So it helps to decrease the likelihood of tears as well to the genitals, because it also decreases dryness that can then cause micro tears in the skin. It's also really important to note here that oil-based lubricants are not recommended for use with latex condoms, because they can actually have a chemical reaction that can weaken and break down the condom. So yeah, great job, y'all. Next up, let me see. Multiple choice. Which bodily fluid does not transmit HIV? Is it A, semen, B, breast milk, C, saliva, or D, blood? Oh, I'm seeing a lot of, okay. Y'all are pros. Y'all are pros. I'm just going through the motions at this point. Yeah. So a lot of times when young people come in, they do think it's saliva because it's one, it's a very we talk about like the different stereotypes or misinformation that can persist around HIV, and really letting young folks know that, while there are certain STDs that can be transmitted via saliva, HIV is not one of them. And explaining, in terms of that it's just, you'd have to come in contact with a lot of a person's saliva, a lot of saliva with HIV positive saliva in order to transmit that. And so that doesn't, talking about the practicalities of what that looks like is really important. Myth or fact? PrEP, or pre-exposure prophylaxis medicine, is a medicine that can help people who are HIV negative take so they can prevent HIV and from getting HIV either from sex or injection drug use. So what do you all think? Is this a myth or a fact? All right, I see. Got some answers coming in. All right, we're going to keep on going. And it is a fact, but I think for those of us who are doing work with young folks and doing work with women and girls, it's really important to note here that according to the CDC, only 10% of women who were prescribed PrEP that could have benefited from it. And so one of the things here is really important to note that there's a big missed opportunity for healthcare providers to have conversations with women and young folks around, accessing and utilizing PrEP as a prevention strategy. Next up, myth or fact? If a pregnant person has HIV, there's a chance they could pass it on to their baby. Myth or fact? All right. So, yeah, let's see. Moving forward, that's a fact. So we know that HIV can pass from parent to child via the placenta, even during childbirth, and via breast milk. So yeah. Another one is another myth and fact one that we have coming up is that receptive sexual intercourse can increase the likelihood of HIV transmission. So penetrative intercourse, that is that true or false? or myth or fact rather. I apologize, y'all. All right, so moving on. That is a fact. So just the simple like brass tacks of it, there's more surface area of skin that could cause micro tears. There's more likelihood of coming in contact with bodily fluids in that way. So yeah. And so this is one we come up with a lot because of trying to, correct misinformation. True, myth or fact, HIV can be transmitted using someone else's comb or hairbrush. Yeah, so that one is definitely a myth, but we want to make sure that folks understand, or young people understand, especially young girls and women, that there's no contact with the bodily fluids that typically transmit HIV, and so therefore it's not coming in. There's no chance of coming in contact with it in those ways. But this is also a moment that we like to utilize to make sure that we're addressing a lot of stigma and shame that can exist around HIV and those living with HIV, right? And so I kind of move on through some of these. So myth or fact, HIV can be cured. So yeah, so folks are already understanding, yep, that's a myth. And it's really important to have conversations here around like the importance of early detection and early surveillance, and knowing that while they're really important treatments such as ART or antiretroviral treatments, there is no cure. And so getting tested early, knowing your health status consistently is a big part of this overall prevention strategy. And then last one, who can get HIV? A, women and girls. B, only people who use drugs. C, people who are over 18 years old, or D, and the answers are already coming in because y'all are pros. Anyone can get HIV if they're participating in unprotected sexual activities or sharing needles such as drug use. And that's why it is so important to know your health status. So Tamara, I hope I did not go over too terribly much. And y'all were amazing. I hope that was a refresher for some folks, but these are just some of the ways that we like to engage with young folks to get their kind of wheels turning around some of the basics around, public health, sexual health, HIV prevention, and how that wraps up to an overall community health strategy. So yeah, thanks y'all.
Thank you so much, Heather. Yes, that is amazing use of our time to see how folks are thinking about HIV, what they know about it. That's how we use youth engagement and challenge them to participate in STD prevention education. So I loved it. Thank you so much. We are really thankful to Heather and Dr. Battle and all of our contributing partners of this series. We really wanted to take some time for them to be able to describe what services they have specifically to testing and treatment, to support groups for those living with HIV, to social support and life skills for young ladies, risk reduction, prevention, and specifically education for women and girls. So we're going to take a moment to acknowledge all of our collaborating agencies and give them a few minutes to talk about what it is that they bring to the table. And so first we'll bring Ms. Lois Brown. She's a senior community health educator for Planned Parenthood South Atlantic, which does our evidence-based curriculum through their Teen Connections program. So if you could unmute and tell us about your program, please.
Hi, everyone. How's everybody doing? This has been awesome for us, Tam. Thank you so much for having us and having Heather to give out information. So our program, Teen Connections, is a community, community effort that we do. Teen Connections community health educators provide high quality education that reflects the needs of young people, the parents, and just patients in general and the communities that we serve. We focus on helping young people achieve their full potential while ensuring communities gain access to the health and care and information that they need, okay? So we offer evidence-based programs that teach young people to make lifelong healthy decisions. We use a peer education model to equip them with medically accurate, age-appropriate information about reproductive health and teen pregnancy prevention. This helps them make responsible decisions and become accurate sources of information for their friends and communities. We have education outreach programs throughout North Carolina, South Carolina, Virginia, and West Virginia. Once these teens and parents, we have parents programs also, but once the teens complete our programs, they can become a part of our alumni. And this is a great opportunity for them as young people who are passionate about teen health and making a difference in their community. The continued participation in the alumni group makes great additions for their resumes and also through the communities that they will be serving, okay? We also offer middle school and high school programs, Promotories program, CMO Sinestos program, LGBTQ programs, parents programs, adolescent mother and pregnant teens programs, as well as virtual statewide programs. We also offer one-shot sessions on different topics, parent workshops, and family game nights. We also offer stipends when programs are completed for our teens. If anybody have any questions about what we do offer, just email me or get in contact with me. I'm gonna put my email address in the chat, and I also put some information, a link in the chat that you can go to about all the classes that we offer. So thank you again, Tamara, for having us and having us to collaborate with you. This has been a great effort, and we thank you.
Yeah, no problem. Thank you so much for showing up for young people and women on today. Our next collaborating agency is the Cumberland County HIV Task Force. Ms. Caraway, I think I saw you on mute.
Yeah.
Awesome.
I am.
She is a public health professional and the secretary of the HIV Task Force, and she'll tell us more about that agency.
Yes, thank you, Tamara. First of all, I want to say a great program, and Dr. Paddle was wonderful, as well as Heather. You're doing a great job. I enjoyed all of it. So the Cumberland County HIV Task Force was established in 1986. It is an all-volunteer organization, and the primary mission is to distribute information on HIV and AIDS, and also to serve as a referral for people with HIV or people affected by HIV. And we meet the first Tuesday of each month at 12 o'clock at 310 Green Street. That's the community room, which is a part of the Cumberland County Community Foundation. And currently we're meeting virtually, but folks are welcome to come in and join if they're interested in making an impact on HIV and AIDS, and of course, reducing numbers and rates. Mm-hmm.
Thank you so much. And I will drop in the chat the link to the Facebook for the task force. I'm on the task force, so happy to share more information if anyone has any questions. Next, we'll have up Teens Do Care. Ms. Jackie Jackson, who leads this effort. Ms. Jackson, could you unmute and tell us more about your agency?
Hi, everybody. Glad to be here. We have several different things with Teens Do Care, but I think what would be more important to this group here is our girls group. We have a group called Little Divas, as well as our beautiful girls, and then our older girls, Young Ladies of Excellence. And what we do is we teach them how to give support to themselves. We teach them about self-esteem, about building their character, what they want to be, also the beauty part of it. We take them on field trips, places that they may have not gone. We do some education on STDs and HIV, but after viewing this program, I think we need to do more. So I'm going to implement something where that would be a part that they will have to really know about. We offer community services among the teens, and we give them things if they complete so many community service hours. So sitting here listening to this and seeing how important it is, I think one of the community service I'm going to have them to do is where they get to educate me on HIV and STDs, and we give them, the rewards from there. We offer them laptops, we offer them money, we offer them cell phones, things that teenagers like, game systems and things of that nature for them to finish the community service hours. So I really love this, and it was very educational.
Thank you so much. And she'll drop into the chat more information on how you can contact Teens Do Care as well. Our next collaborating agency is Community Health Intervention Specialty Clinic. I'm not sure if Ms. Barrett was able to get on. Ms. Barrett. she was having some tech issues as well. But Ms. Eva Bear is the program manager at Community Health Intervention Specialty Clinic, and they provide testing and treatment as well as counseling services for those who are HIV positive. I am going to drop into the chat a way to contact her. And so if folks are looking for additional information, especially treatment and care if they are HIV positive, and connection to PrEP for those that are involved with an HIV positive partner, they can reach out to her that way. So I'll make sure I drop that in the chat for folks. Next, we have Ms. Patty Jordan. She's with the Fayetteville Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and she'll be telling us about Delta Gems. Ms. Jordan?
Thank you so much. It's a pleasure to be here, and thank you for having me. I am the chair of the Delta Gems, which does stand for Growing and Empowering Myself Successfully. The young ladies are between the ages of 14 and 18, grades 9 through 12. And what we hope to do, what we try to do with them is develop their dreams and aspirations of college, career readiness, leadership skills, also individual growth, self-care, and self-confidence. We try to instill in them a can-do attitude, and we strongly encourage academic success. And also with the young ladies, we incorporate some etiquette so that they can present themselves in an appropriate manner at all times, because no matter where you are, you don't know who's watching you. You don't know who will be able to help you somewhere along the line. And so we try to instill that in them, that it's important to be on your best behavior at all times. Our young ladies are just awesome. We have 15 engaged with us this year, and they've come up with some nifty ideas. One is the community service project that they came up with that we'll be doing for the homeless. And they came up with a list. Thank you for putting that up. They came up with all the suggested things that people will drop off, and that drive will be March the 19th, 321 Bradford Avenue at the United Order of Tents. And our time that we will be there is between 1 and 2:30. So if anyone would like to come by and just drop off a little something, that would be awesome as well. Another thing that the young ladies have come up with, which just blew us away when they came up with it, because they said, we want to come up with some motivational sayings. And we've been doing that as a challenge, and we've been doing it through the month of February on into the month of March. And we'll collect that at the drive date as well. And the young lady said that we want to be able to help other people who may be having challenges in their lives and maybe going through things. So we just want to give them something that they can hold on to that will help them get through their day, months, weeks, whatever they may be going through. Also, they're going to be doing comfort kits, making those, sewing those together, and those will be going to the Child Advocacy Center. So they have been quite busy, and we try to engage the young ladies because it's all about them. We're here for them, and we want them to stay engaged and keep coming back. So that concludes my presentation. If anyone has any questions, I'll be glad to answer those as best I can. And thank you so much for your time, and thank you so much for inviting me.
We're glad to have you. Thank you so much for sharing what the Delta Gems are doing, that awesome donation event. I do have a quick question for you. If people want to donate but are not available during that time, are they able to reach out to you to drop off items outside of that 1 to 2:30 time frame?
Yes, I can put the email in the chat, and we can work out something.
Awesome.
That's an awesome question. Thank you so much. Okay, I'll put the email in the chat.
Great, thank you.
All right, thank you.
Next, we have Ms. Doreen McGill. She's with the Fort Bragg Area Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And she's going to tell us more about Delta Academy, which is another initiative for young girls. Ms. McGill. I know I forget to unmute sometimes.
I'm sorry, I'm just babbling. Good evening, everyone. I'm Doreen McGill with Delta Academy with Fort Bragg Area Alumni Chapter. And I just want to thank Dr. Battle and Tamara Morris for inviting me. I'm not going to be before you long. I just wanted to do a brief introduction about Delta Academy. So this year, we've basically been virtual due to the pandemic. And hopefully next year we'll be up and running back face to face. So currently we have 7 Delta Academy young ladies. We've been doing everything we can to make it innovating and engaging, because after the last 2 years of virtual academy with the students, it's been hard, but our girls have been engaged and I really appreciate them. So for December, the young ladies decided to do Christmas cards for the senior citizen home in Hope Mills. So that was our first service project. They're really into STEM, which is one of the thrusts of Delta Academy. They're very artsy, so they like hands-on things and artsy, and the very, very impressive group of young ladies, very bright. So I just wanted to give you some background information about what the Delta Academy is. So Dr. Betty Shabazz created the Delta Academy out of an urgent sense that was needed to save our young females. We have females between the ages of 11 and 14, and it was designed to save them from public education, from low self-esteem and their crippled futures. It's designed to enhance and enrich our education of young women and get them engaged with those, get them engaged with those thrusts with scholarship in STEM. So STEM is science, technology, engineering, and math. And we want to provide young ladies, especially African-American women, in those careers, because despite making up like nearly half of the United States workforce, women still vastly are underrepresented in STEM careers. I myself am a high school biology teacher, and I try to get my students engaged in as much as I can in the classroom, but especially females. A couple of years ago, I did research at NC State. And even during that program for 6 to 8 weeks, they were talking about the shortage of women in STEM careers. So women have made gains from like 8% of STEM in the workforce from 1970 to 27% in 2019, but men still dominate that field. So Dr. Betty Shabazz, she even had a vision back then about trying to make gains for young ladies when she established the Delta Academy. So the program augments their scholarship in STEM, their opportunities to provide service in the form of leadership through service, learning defined as the cultivation and maintenance of relationships. So even as a teacher, we know that it's important to establish relationships. Students won't learn from you until they know that you care. So I have 2 people that work with me closely, another Sarah, and we have a volunteer, and we've tried to establish relationships with these young ladies. And like I said, I adore them. The past year and a half has presented a challenge both socially and emotionally and academically for some of our young people due to the recent pandemic. So the Delta Academy is also designed to address some of these young girls in all these areas to best prepare them to be 21st leaders of the, to be leaders of the 21st century. So what are some of the activities that we do with the Delta Academy? We've designed activities to try to tackle some of the self-esteem. We have etiquette, things that we want to work on as far as young ladies. How should a young lady act, speak? That's one of the program thrusts. Historically, cultural enrichment, early financial responsibilities, that's another program thrust. Medicine and technology, which is part of the STEM, we want to address those things. So we look at the young ladies as scholars. We try to keep the bar high, try to expose them to leadership opportunities in the community and participate in community service activities. If you have any interest in the Delta Academy, we invite you to click on our link. I think that should be, is that there? If you have a daughter in middle school, age 11 to 14 years old, and you're interested, our applications are typically distributed in our meetings held in September of each year. So click on our link, www.fortbraggdeltas.com, for the applications in the fall. I also will drop my information in the chat for you. I'm Doreen McGill. But yes, please click on our website for further information about the Delta Academy.
Thank you so much. That we know that involving young women in activities that promote social engagement as a result just automatically gives them something to engage in, and their social behaviors are improved. So they're also reducing HIV through that realm as well. So we appreciate that. Thank you.
Yes, thank you for having me.
Yeah, no problem. And I see a comment in the chat looking for the Teens Do Care email. Ms. Jackson, if you can drop that in, that would be great. Thank you. All right, and next up for our collaborating agencies is the Health Department. So we are going to share a little bit more through Ms. Janaya Benners. She's going to share about our health programs that we have here and educational opportunities as well.
As Tamara said, my name is Janaya Benners. I'm a health educator here at the Health Department located at 1235 Ramsey Street. Our teen wellness and adult clinics provide high quality, friendly, and confidential testing and treatment for STIs. Teen wellness sees adolescents ages 12 to 19 for varied reproductive and sexual health services, and the adult clinic services ages 20 and up. Testing is always free, and other services may be free or low cost as well. Payment options are insurance, Medicaid, or are on an income-based sliding scale. We also have an educator who serves as a youth advocate in the wellness clinic. The advocate provides real talk, one-on-one connection to teens seeking support on healthy relationships, sexual risk reduction, decision-making, and more. Our parent engagement promotes being an askable adult and increasing caregiver communication between them and their young person. We can also provide evidence-based sexual violence prevention guidance to the CDC curriculum, Parents Matter for Dating Matters. A resource for parents regarding sexual health and HIV risk reduction is preparedparent.org. For Youth Connection, we also offer comprehensive and abstinence-based education programs. Teens are referred to teenplaybook.org, their guide to safe choices, and we also encourage the use of amaze.org, which has animated videos on a plethora of topics concerning their age group. And for any questions or to make an appointment, you can contact us at 910-433-3600.
I'm a little biased, but I'm like, yay, Teen Clinic, yay, health education. So thank you so much, Janaya, for sharing our efforts. And I dropped in the chat those web links that she talked about for parent support and teen understanding of sexual and reproductive health education. And we're encouraging you all to follow us on Facebook as well. We are new to the social media game. We have a Facebook and an Instagram, and we encourage you to follow us and share things there, events and programming that we can get out to the community about your agencies as well. And so this has been really great. I really have appreciated all the information that has been shared, all of our collaborating agencies and how they've been able to provide information about how they can empower young women and adult women to take care of themselves, to share in community, to provide prevention services, and to each one teach one. Very enlightful and inspiring stories that were shared. So I appreciate that. We tested our knowledge skills with Heather today. So Heather, thank you so much for providing us with that myth or fact section, and Dr. Battle, such great information that you provided with our keynote. So we're really appreciative of that. We've reached the end of our programming here tonight, so we really appreciate you all being on with us. We do have an evaluation survey that we would like everyone to participate in. If you could drop into the chat and click on that link, that'll take you to a Survey Monkey that'll take you all of 1.5 minutes to complete. Just a few questions about your experience with the webinar tonight and letting us know how we can make it better going forward. We do encourage folks to get tested. And so whether they are doing that at the specialty clinic with community health interventions and Ms. Barrett, or they're doing that here at the health department or at their primary provider, wherever that may be, we encourage them to know their status and help us to stop HIV together. If you're making comments online about your experience here tonight, we encourage you to use that hashtag, that's Stop HIV Together. And I'll put that in the chat. So take charge of your health and make sure that you know your status. I think Dr. Battle said, are you positive that you're negative? And so we're going to go ahead and carry that forward in knowing our status going forward. But thank you all so much. We're right at our time. We're at 5:56. I'm going to drop in the evaluation link once more, just in case anyone didn't get to scroll up and see it. If you would please answer those questions to help us with educational programming going forward, we would greatly appreciate it. And thank you so much. You all have a great evening.